Feijão malaria causes some fever in upcoming Tanzanian children. Malaria. Definition. An infection disease caused by protozoan parasite from the Plasmodium family that can be transmitted by the bite of the Anopheles mosquito or by a contaminated needle on transfusion. Falciparum malaria is the most deadly type.
Created using Powtoon.
Other causes of fever. Malaria is not the only disease that causes fever, as the incidence of malaria diminishes as better understanding of non-malaria fever is important for effective management of illness in children. In this study, we explore the spectrum of causes of fever in African children.
This is Jeffrey Drazen for the New England Journal of Medicine. In Dar es Salaam, the 3-year-old boy wakes in the night, calling out to his parents. His mother lays her palm on his forehead, which is burning. She applies a wet cloth to his head and sings to him until he is asleep again. "I'm worried it's malaria," the father says. 2 days later, the boy's fever has not resolved. The mother brings her son to the clinic. "Is it malaria?" she asks the doctor. Doctor shakes her head. "It might be something else," she says. "Let's have a look." In many parts of Africa, malaria transmission is declining. Now that there are point-of-care, rapid diagnostic tests for malaria, healthcare providers face a new and daunting challenge. If a malaria test comes back negative, what might be making this child sick? What is the appropriate course of action? In a study reported in the journal, the etiology of fever was investigated in children in Tanzania. Just over 1,000 children under 10 years of age and with a fever of 38 degrees Celsius or higher were recruited at outpatient clinics. Blood samples and nasal and throat swabs were taken. Within an hour, malaria and a number of bacterial illnesses could be ruled out. With this information, initial treatment plans were formulated and, if indicated, treatment was started. These plans could be modified when additional results became available, usually within 5 days. The final diagnoses for the cause of fever, such as malaria, upper respiratory tract infection, pneumonia, systemic infection, or gastroenteritis, were determined through algorithms using pre-specified criteria and were not available in real time. A possible etiology of fever was identified in almost all of the children. It was a virus more than 70% of the time. For the febrile child in a third world setting, once malaria and tuberculosis have been ruled out, if there are not strong clinical indicators of a bacterial process, these data provide reassuring epidemiological evidence that it's okay just to follow the illness and not to treat with empiric antibiotics.
Application in nursing. We recruited children younger than 10 years of age with a temperature of 38 degrees Celsius or higher and to open clinics on rural and one urban. In Tanzanian medical history, we obtained a clinical examination conducted by means of systematic procedures. Blood and esophageal specimens were collected to perform rapid diagnostic tests, serology test cultures, a molecular test for potential pathogens causing acute fever.
Feeling a little bit hot. I'll be back in a minute.
Check their temperature by using a thermometer.
Okay, good boy. Let's see.
You are hot. Okay, let's just get all this off. Come on.
Reduce their temperature by removing excess clothing and giving them regular fluids such as water or diluted juice.
Good boy. Right. Just come here.
Give the recommended dose of paracetamol syrup.
Okay. Here you go. Good boy. Do you want to lie down? Okay. Lie down. Good boy.
Specific treatment will be depending on what is the cause of the fever. For example, if there is a particular typhoid bacterial infection or any other specific reason, then the doctor will prescribe antibiotics for that specific cause. Most other fevers will need supportive management. For example, sponge and antipyretic medication.
Pros and cons of the drugs. Not all drugs that are used for malaria are suitable for treating disease that causes fever. For example, Malarone pros, good for last-minute travel because the drug is started 1-2 days before traveling to an area where malaria transmission occurs. Some people prefer to take a daily medicines. Cons, cannot be used by women who are pregnant and breastfeeding until less than 5 kilograms, be taken by people with severe renal impairment. Insuable in Ecuador. In Ecuador, the last death from malaria we recorded in 2008, according to the Ministry of Public Health, in the country indicate that malaria cases decreased by 99% in the last decade between 2001 and 2012. The Public Health Agency reported food humor in 2012, a total of 568 cases, 478 for the type P. vivax and P. falciparum 280. We reported represented a reduction of 98.8% compared to the 37 million and 2069 infection of 2001. For the decrease, the morbidity caused by malaria by 70% in the last 2 years. Ecuador received in 200,000 the champion of the fight against malaria in the American Award from the Pan American Health Organization. conclusion, this should provide a description of the numerous causes of fever in African children into representing. There is an increasing awareness that most acute febrile episodes are due to other infectious diseases, some of which are life-threatening that must be identified and treated appropriately. World Health Organization guidelines recommend malaria testing for the patients with febrile illness in areas where malaria is endemic. The study have shown that the decrease in the use of anti-malaria therapy has been accompanied by a commensurate increase in antibiotic use. Stakeholders have recognized the need for an improved understanding of non-malaria fever, both to optimize cure and to reduce inappropriate antibiotic. Thank you.